Hi, my name is Dr. Charles Katopes from Digestive Health. I'm just going to spend a moment today discussing men's health. Men's health encompasses a number of different issues, which can range from things as basic as nutrition and exercise to topics such as cardiovascular disease and cancer screenings. The pandemic has dramatically altered the way people's routines have been led day to day, given the complex issues of social isolation and trying to avoid this virus that has taken over the world. As a result of this, risky behavior has escalated, such as drinking alcohol, tobacco abuse, and even binge eating. And it goes without saying that moderation is key in regards to eating and drinking alcohol. In regards to tobacco use, there's no such thing as moderation. Anybody who smokes should strongly consider stopping. I've always found men notorious for neglecting their own health care until a problem develops. So what can men do to improve their health? First and foremost, it starts with better choices and care at home. Moderation, as I mentioned, is key when it comes to eating and alcohol consumption, and obviously eliminating tobacco. The first thing that really cannot be overstressed is seeing a doctor and taking care of your health care even when you feel well, and that includes checkups. What's addressed at these checkups? Things as important as cholesterol, blood pressure, both of which are felt to be silent killers when they're not controlled, and can lead to the number one cause of mortality, which is obviously cardiovascular issues such as heart attacks and atherosclerotic disease. In addition, things such as cancer screenings and vaccines would be addressed at these visits. Importantly, in men, we put emphasis on testicular cancer screening, prostate screening, and colon cancer screening. In regards to vaccines, obviously most people in the world realize COVID has overtaken the world, and now we have the COVID vaccine, which not all men are yet candidates for, but soon enough they will be. In addition, there are numerous other vaccines that will be addressed as well. Last, but surely not least, with social isolation being the way of life these days, it cannot be overstressed how important depression is. I found more and more men coming through my door reporting how depressed they are given the social dilemma we're dealing with in regards to this virus. And depression screening should be performed at every doctor visit, and will be, and the treatments we have are so effective these days that it can be life-changing. Aside from that, there are numerous other issues that are always addressed and can be discussed with your primary or even specialty doctors. So if you have questions, please don't hesitate to ask.